Welcome to Marian Ayurveda. In this episode, we are going to discuss a uterine disease called endometriosis. Many women are familiar with this disease. Endometriosis is one of the main causes of severe pain during menstruation. Similarly, endometriosis is also a major cause of infertility. I am Dr. Anumod Kakkassery from Marian Ayurveda Thrissur. Endometriosis is a disease we frequently encounter in our practice. We often say that endometriosis is a condition where Ayurvedic medicine has been very effective, especially in reducing pain and providing relief. In this episode, I will be talking about how Ayurveda treats this condition, what treatment methods are followed, which medicines we use, and what kinds of dietary habits endometriosis patients should pay attention to. First, let's briefly understand what endometriosis is. We know that inside the uterus there is a lining called the endometrium. This lining grows by absorbing blood and then sheds during menstruation, which is what we refer to as menstrual blood. This menstrual blood, or what we call the endometrium, is something that should only be found inside the uterus. But sometimes this tissue is found outside the uterus, sometimes on the large intestine, or near the heart, or in the lungs, or on the anal ridge, or on the ovary, and in various other places. This causes a lot of pain during menstruation. When menstruation occurs, this tissue, whether it is in the abdomen or in other parts of the body, will also bleed there. This causes a lot of pain. In short, this is what we call the disease endometriosis. If you ask why this disease occurs, many people do not have a definite answer. A lot of research has been done on this. One important study says that the menstrual blood, which is supposed to flow downward, gets blocked for various reasons. This study says that the blood travels through the fallopian tubes, which are like two arms of the uterus, reaches the outside of the uterus, and attaches itself there. When several studies were conducted on monkeys to prove this, scientists found that when the uterine blood was blocked, it traveled through the fallopian tubes, and the monkeys developed endometriosis. Similarly, another reason that many people mention is that often when this menstrual blood travels through the fallopian tubes or other pathways and reaches outside the uterus, it usually does not attach itself. But in certain individuals, it does attach itself outside the uterus. The scientific community is still searching for the reason behind this. So, this is how far science has reached when it comes to understanding the causes of endometriosis from a scientific perspective. Now, we also need to classify endometriosis itself into different grades. When it comes to the pain from this, I have seen cases where during a scan, endometriosis is detected, but when you ask the patient if they experience severe pain, some of them actually have no pain at all. So why is it that some people experience pain while others do not? If we try to visualize endometriosis itself, we can actually see different types of endometriosis. There is endometriosis that appears white in color, some that are bright red, and some that are dark brown or chocolate colored. When this endometrium attaches to the ovary, it turns into a brown colored endometrium, which is referred to as a chocolate cyst, and becomes endometriosis. Similarly, it can be dark red or bright red. Normally, when the endometrium attaches itself outside the uterus, it receives blood circulation from that area, grows there, and bleeds there. These are called stem cells, and it is these basic cells that, when they attach themselves outside, stay wherever they attach, receive blood from that area, and bleed there. That will actually be bright red, and it will be extremely painful. This chocolate cyst is also painful. But if the endometrium appears white in color, what we understand from that is that it is not receiving blood circulation there, and it is not that active. That is why it does not become as painful. Similarly, when the endometrium is present in these outer tissues or in the deeper layers, it is called deep infiltrating endometriosis, or DI. That means if the endometrium attaches to the intestine as it goes deeper, 1 millimeter, 2 millimeters, 3 millimeters deep, the deeper it infiltrates, the more difficult it becomes to treat and remove it. So these are the basic facts we need to understand about endometriosis. Now, as a doctor, and specifically as an Ayurvedic doctor, endometriosis is a condition that can be treated in many patients, and I would say it is one of the diseases that gives me the most satisfaction to treat. Now, I am going to talk about some of the concepts I follow, certain Ayurvedic concepts, and also about the medicines we use in this context. One of the main concepts I focus on is that generally, when I observe people with endometriosis, they tend to have severe acidity problems or issues with gas. Often these individuals either skip meals, drink excessive amounts of tea, consume a lot of spices, or eat pickles. I have noticed that endometriosis is more commonly seen in people with such habits. That is why I always approach this condition as one related to acidity or hyperacidity when treating it. There is also a scientific aspect to this. When acidity increases in a person's body, the many smooth layers present in our body are lost and those areas become rough. We know that When a place becomes rough, all kinds of dirt and things tend to stick there. In the same way, the endometrial blood or that tissue, which is supposed to exit the body, sticks to the rough areas of our body and starts to grow there. That's why when we do this kind of treatment, new layers form there, right? There are good medicines for that. As these layers form, the endometrium partially detaches from there, and from what I have seen, the pain subsides. Similarly, the second possibility is, as we know, worms, what we call pinworms, those thread-like worms. The main place where they are most commonly found is also said to be the vagina. After the anus, the area where we can most often find worms is in parts of the uterus and vagina. So sometimes this can cause damage to the lining tissues here, and there is a possibility that endometrial blood may get stuck there. These are the two main things I focus on in my treatment. That's why, when asked which foods we should avoid, my advice is to completely avoid foods that can cause acidity, to take deworming medicines from time to time, and to take them at least once a week. So without completely avoiding all foods that are spicy, sour, or can cause acidity, some people who consume a lot of spices, green chilies, or black pepper will experience severe pain during menstruation or with endometrial issues. Therefore, we need to completely shift our diet towards foods like milk, ghee, butter, and similar items. Basically, diets that do not contain too many spices. So that's how it is. When it comes to medicine, I can suggest a very simple treatment. Many times after a patient comes to see me, they are not sitting, they are standing. When I asked why, it was because of endometriosis due to the pain, and it was during the menstrual period. At that time, it's impossible to sit, it's that painful. So I said, right then, I have a bed nearby, and I asked the staff to let her lie down there. There is a medicine called Dhanyamrutam, which is like a liquid to be applied on the lower abdomen. You can get it at almost any store. They told us to apply it on the lower abdomen using a cloth, and within 10 minutes, the pain was gone. This is a good method you can do at home to reduce endometrial pain without using any painkillers. So you can get a product called Dhanya Amlam at stores. This is not a treatment, it's not a complete cure, but it's a simple technique to manage acute pain without painkillers. Apart from that, there are many medicines available to manage our acidity. Through that, we are gradually eliminating what is called endometriosis. So in another episode, we will meet again with another disease. Thank you.